So that's step one. And the metaphors we use for that is like the polygraph metaphor that we did before. We can also use, there's so many, tug of war, like that. We can use pushing on the paper like we did before. All of these are techniques you use to demonstrate to the client control strategies make things worse. Control strategies will not work for you. That's all step one of ACT is creative hopelessness. Stop trying to control something that can't be controlled. So we'll do many of these metaphors with clients. I definitely do pushing on the paper and having them write every client I do that with. I definitely do polygraph metaphor, lie detector, and definitely do, we can do love metaphor too. So that's step one is to stop trying to control, let go of control, because control is the problem. Trying to control something that's uncontrollable will fail, and that's the problem. The problem isn't that you have a thought that you're not a good enough mother, that you're unlovable, that you're not smart enough. That's not the problem. The problem is that you think you need to get rid of that thought to live a good life, and that will never work. So you have to let go of that. You have to accept that. Okay, want to try to need to translate? Okay.
ខ្ញុំ highlight ពាក្យ creative hopelessness របស់គាត់មិញហ្នឹងបើយើងមើលទៅលើអីដែលយើងបានធ្វើពីព្រឹកមកហ្នឹងមិនជា feeling hopeless ទេអានេះ hopelessness ដែលមានពាក្យ creative ពីមុខអញ្ចឹងគោលបំណងយើងគឺយើងប្រើ metaphor ទាំងប្រមាណដែលគាត់បានធ្វើជាមួយមិញហ្នឹងគោលបំណងចង់ឲ្យ client ចាប់ផ្ដើមមានអារម្មណ៍ hopeless ក្នុងលក្ខខណ្ឌនេះ hopeless ក្នុងការដកអាគំនិតមួយដែលគាត់ចង់ដកគំនិតដែលគាត់អត់ចង់មាននឹងចេញអញ្ចឹងដូចខ្ញុំសូមឧទាហរណ៍ទៅករណីបង្គាមិនអញ្ចឹងទៅដែរអា scenario ដែលគាត់ធ្វើដំបូងគេបន្ទាប់ពី CBT ហ្នឹងគឺយើងចាប់ផ្ដើមឃើញយើងឃើញ reaction របស់ client មកត្រឡប់មកវិញព្យាយាមសួរទៀតថាanxiety របស់គាត់មិនគាត់មានអារម្មណ៍មិនល្អទេអញ្ចឹងអាក្នុង question ដែលរបស់ client យើងតែងតែមាន now what ខ្ញុំចង់ដកវាចេញអញ្ចឹងយើងព្យាយាមសួរថាដែលមានកំណត់នឹងយូរឆ្នាំនៅខ្ញុំមានយូរហើយទីមួយគាត់ចាប់ផ្ដើមអ្វីថាយូរហើយយូរហើយចូលចិត្តកំណត់នឹងអត់ចូលចិត្តទេបានធ្វើអីច្រើននៅក្នុងការដកវាចេញដល់ពេល3នឹងបូកចូលគ្នាមានន័យថាយើងដូចសង្ខេបដូចគាត់វិញអ្នកឯងមានកំណត់នឹងរាប់ឆ្នាំមកហើយព្យាចូលចិត្តវាអត់ចូលចិត្តទេអត់ចូលចិត្តហើយព្យាយាមគ្រប់វិធីបែបយ៉ាងដកវាចេញតែអ្នកឯងជោគជ័យអត់អាចុងក្រោយគេដែលខ្ញុំតែអ្នកឯងជោគជ័យអត់ក្នុងការដកវាអញ្ចឹងបើសិនអ្នកឯង40ឆ្នាំ30ឆ្នាំដោះស្រាយជាមួយនឹងកំណត់នឹងអត់ចេញ therapy អត់ឃើញអត់កើតដែរអញ្ចឹងទីមួយគឺយើង let go នៃក្នុង creative hopelessness កន្លែងហ្នឹង creative កន្លែងហ្នឹងទេចង់ឲ្យគាត់យល់ថាអ្នកឯងធ្វើវាច្រើនឆ្នាំហើយគំនិតហ្នឹងបើសិនយើងនៅតែព្យាយាមដកវាចេញអាហ្នឹងឯងគឺជាបញ្ហា
So then we go to acceptance. If you can't control, learn to accept. Acceptance is allowing thoughts and feelings to be present without fighting them, to learn to be present with them. So I'm going to practice that with you. So allowing the scary or unwanted thoughts and feelings to be present without trying to push them away. And it's hard for people because they don't like it. They don't want to have the bad thought. They don't want to have it. They want to push it away. And you're saying, do not have to. Welcome every thought that comes without interference. And that's willingness. So I'm going to, we did ugly baby. So there's metaphors for that. We have Bob. We have and but. Quicksand. Do you want to do Bob?
You can do Bob.
So another metaphor we'll kind of explain to people is if you can't, these are acceptance metaphors, ways that you can accept thoughts and feelings without pushing away. And remember, it's creating flexibility. Instead of fighting, accept. And so we try to create many different ways that people can think about it. You want to do Bob? Okay, we have Bob. Here's a metaphor I tell patients.
មុនហ្នឹងយើងសាកប្រើឲ្យ metaphor ឬក៏លើកឧទាហរណ៍ពាក់ព័ន្ធជាមួយជិះឡានមិនតែលើកនេះយើងប្រើ metaphor មួយ Bob អញ្ចឹងអ្នកទាំងអស់គ្នាធ្លាប់ធ្វើការមានមេឬក៏យើងជាមេគេឬយើងអ្នកដឹកនាំឬក៏យើងមានសមាជិកអ្នកធ្វើការជាមួយទាំងអស់អញ្ចឹងយើងមិនមែនធ្វើការម្នាក់ឯងភាគច្រើនយើងធ្វើការមួយអ្នកផ្សេងអញ្ចឹង Bob ក្នុងឧទាហរណ៍នេះគឺជាសមាជិកកន្លែងធ្វើការមួយដែលយើងអត់ចូលចិត្តអញ្ចឹងខ្ញុំឲ្យយើងសម័យទាំងអស់គ្នាថាយើងនឹងជាមេដឹកនាំមួយ CEO ចុះហើយយើងមានបុគ្គលិកយើងច្រើនណាស់ហើយយើងច្បាស់ថាមានបុគ្គលិកមួយឈ្មោះ Bob ហើយ Bob ហ្នឹង គាត់ញ៉ៃញ៉ៃជាងគេទៅជប់លៀងហើយគាត់ផឹកស្វឹងអាឡូអាឡាធ្វើឲ្យនិយាយទៅធ្វើឲ្យកន្លែងធ្វើការរៀងច្បងច្បល់អញ្ចឹងយើងជាមេដឹកនាំយើងមានកម្មវិធីមួយជប់លៀងហើយយើងមិនត្រូវហៅសមាជិកអ្នកធ្វើការជាមួយនឹងយើងហៅទៅទាំងអស់ទាំងបបទៅដែរអញ្ចឹងយើងជាមេប្រកាសជាយើងចាប់អារម្មណ៍អ្នកទាំងអស់គ្នាឯងប៉ុន្តែយើងដឹងថាបបនឹងញ៉ៃញ៉ៃជាងគេអញ្ចឹងយើងធ្វើអីគេយើងចាប់អារម្មណ៍គាត់ឃើញបបឧទាហរណ៍ចំពងជប់លៀងអ៊ូអសប្បាយអញ្ចឹងទៅបបចាប់ផឹកស្វឹងយើងដំបូងយើងទៅប្រាប់គាត់ហ្នឹងថាបបកុំផឹកឈប់ផឹកបានហើយយើងនិយាយអញ្ចឹងស្រាប់ស្ទុះក្រោយគាត់ផឹកទៀតគាត់ផឹកហើយគាត់ក្អួតអីចឹងទៅហើយយើងមិនភ័យខ្លាចគាត់ធ្វើឲ្យជប់លៀងហ្នឹងញ៉ៃញ៉ៃយើងក៏នាំគាត់ឲ្យទៅបន្ទប់មួយទៀតទុកហើយឲ្យគាត់ទៅក្រៅដល់ពេលទៅក្រៅទៅមកស្ទុះក្រោយក៏ដើរចូលមកវិញគាត់ដើរចូលមកញ៉ៃញ៉ៃទៀតហើយយើងភ័យទៀតហើយថាអូជប់លៀងដោយសារតែមួយហ្នឹងខ្ទេចហើយអញ្ចឹងយើងក៏នាំគាត់ទៅម្ដងទៀតហើយយើងលែងនៅកន្លែងជប់លៀងទៀតហើយយើងនៅជាមួយបបមកស្រាប់ប្រហែលម៉ោងក្រោយមកជប់លៀងចាប់អស់មានរឿងអីកើតឡើងយើងមានដឹងថាជប់លៀងហ្នឹងមិនដែរអត់យើងអត់បាននៅជប់លៀងហ្នឹងផងហ្នឹងយើងចំណាយពេលមកជប់លៀងយើងជាអ្នកដឹកនាំគេយើងអត់បានជប់លៀងជាមួយគេយើងអត់បានសប្បាយជាមួយគេខេងយើងជប់លៀងហ្នឹងដើម្បីបានចំណាយពេលជាមួយអ្នកធ្វើការជាមួយប៉ុន្តែយើងទៅចំណាយពេលជប់លៀងទាំងស្រុងទៅនៅជាមួយបបបាត់អញ្ចឹងចំពោះការលើកឧទាហរណ៍នេះបបគឺជា passenger យើងនឹងហើយដែលនិយាយមើលទៅយើងភ្លេចមើលអ្វីផ្សេងដែលយើងចាប់អារម្មណ៍ទៅលើវាពេកដែលយើងប្រឆាំងវាយើងខំខាត់វាដែលយើងភ្លេចអ្វីផ្សេងទាំងអស់ I explained it
So we all have Bob and Bob shows up at the party. The only way to live your life is with Bob. And it's okay. So that's all acceptance. What we do after acceptance is we do diffusion. Diffusion is learning to look at thoughts, see thoughts and feelings from a new point of view, from a different point of view. Instead of believing them to be true, we look at thoughts as just thoughts, and that's called diffusion. So there's some techniques we can use for that too. We already did one here where you sing about your thought, push, that's a diffusion. You step away from it and you look at it. But I'll give you some other ones. So let's try this one. I'll do a diffusion exercise for you. So I want you to just, you can just, don't have to do much, but I'd like for you to notice something. In your mouth right now, you have saliva, you have spit. Do you feel it? In your mouth, you have water. And now that I brought up that you have water in your mouth, you notice the water in your mouth. And you're feeling it under your tongue, and you feel saliva more and more. And it's building up in your mouth right now, and you kind of want to swallow it. So go ahead and swallow your spit, your saliva. Go ahead and swallow it. Not bad. Okay. Now, I want you to think of something. Imagine now that you have saliva in your mouth, and instead of swallowing it, you take your cup and you just let the saliva drip out into the cup. So you just let your spit drip into the cup, okay? And then maybe you get a little bit in there, and then you drink your spit. You don't like that idea? That's an example of a rule. Your mind has this idea that if you swallow saliva that's in your mouth that hasn't left your mouth, that's okay, and that's good for you. But if it leaves your mouth for a little while, you can't go back in, that's gross. That's fusion. That's fusion with a rule about good spit, bad spit. And you actually feel kind of gross about the bad spit, but it's just a rule. You're reacting to the rule of good spit, bad spit. That's called fusion. Get it? Yeah.
ខ្ញុំលើកឧទាហរណ៍មួយតែផលមិនទៅដែរទៅលើទឹកមាត់យើងទៅដែរណា អីដែលគាត់ចង់លើវិធីខវិធីសាស្ត្រមួយដែលជួយយើងធ្វើ diffusion កន្លែងហ្នឹងជួយយើងផ្ដាច់គំនិតជាមួយនឹងអារម្មណ៍ជាមួយនឹងគំនិតខ្លួនយើងជាមួយនឹងអារម្មណ៍អញ្ចឹងគំនិតរបស់យើងឧទាហរណ៍កន្លែងនេះគឺករណីទឹកមាត់អញ្ចឹងទឹកមាត់ជាវត្ថុដដែលទេវត្ថុរបស់យើងគឺទឹកមាត់នៅក្នុងមាត់របស់យើងពេលដែលយើងធ្វើការសង្កេតមិញហ្នឹងយើងចាប់អារម្មណ៍ថាវាឡើងម្ដងតិចនៅក្នុងមាត់ដល់មកសន្ទុះទៅទឹកមាត់ពេញមាត់អញ្ចឹងយើងលេបវាចូលវិញយើងលេបវាបានយើងគេថាអីយើងលេបបាននៅក្នុងមាត់នៅឡើយតែអាទឹកមាត់របស់យើងខ្លួនឯងដដែលហ្នឹងនេះពេលដែលយើងចាប់ផ្ដើមបតក់វាមកក្នុងកែវមកតក់ចេញជារូបរាងទឹកមាត់យើងហ្នឹងដល់ពេលក្នុងទឹកមាត់របស់យើងទេឲ្យផឹកចូលវិញយើងចាប់ផ្ដើមមានអារម្មណ៍ថាអ៊ីវខិចខ្ពើអញ្ចឹងជាមេតផលមួយចង់ឲ្យយើងមើលជាមួយនឹងអតិថិជនយើងទឹកមាត់ដូចជាគំនិតហ្នឹងអញ្ចឹងទឹកមាត់របស់យើងទេទឹកមាត់ដដែលដូចគំនិតដដែលហ្នឹងមិនបាននៅក្នុងមាត់យើងវាល្អចេញមកក្រៅវាទៅជាខិចអញ្ចឹងនឹងជាមេតផលមួយជួយឲ្យយើងអាចធ្វើការជាមួយនឹងអតិថិជនដែរទឹកមាត់របស់គាត់ដូចជាគំនិតដែលគាត់ចង់ដកចេញចង់មានអញ្ចឹង
So these are all techniques to try to show the patient when you're fused with the thought, you react to the thought more than spit in a cup and spit in your mouth, same. One just left your mouth for a while, but they're both the same, but your mind says one's bad, one's good, and you react to your mind. So these are called diffusion, teaching patients to look at their thoughts and not get too believe them to be true or embrace the thoughts as true. Can I pick on you for a minute? Come on up here for a minute. Yes, for you. Come on up. I'll show you another diffusion. These are diffusion techniques. So what we're doing here is trying to create a new way of thinking about thoughts and feelings from looking at your thoughts and feelings, not being your thoughts and feelings. So the way that we might do this is, fusion is something that says, I look like a man. That's fusion. Diffusion is, I tell myself I look like a man. There's a difference there. One is, I am a man. That's fusion. I believe it to be true. One is, I have a thought that I look like a man. That's diffusion. Do you see the difference?
I am a man ចឹងខ្ញុំជាមនុស្សប្រុសចឹងគាត់ជឿគាត់មានភាព fuse ជាប់គ្នាភាព fuse ទៅដូចស្អិតជាប់ចឹងអញ្ចឹងមកដល់ថានេះជាគំនិតរបស់គាត់មនុស្សប្រុសខ្ញុំជាមនុស្សប្រុសនៅពេលដែលគាត់ប្រាប់ខ្លួនគាត់ថាខ្ញុំជាមនុស្សប្រុសដូចជាគាត់ជាមួយនឹងគំនិតជាប់ចឹងអញ្ចឹង diffusion អានេះនៅតែគំនិតហ្នឹងនៅតែចឹងនេះខ្ញុំជាមនុស្សប្រុសប៉ុន្តែដល់ពេលខាងភាព diffusion មានតែយើងផ្ដាច់ពីចឹងអញ្ចឹងអានេះខ្ញុំជាមនុស្សប្រុសខាងមួយម៉ាត់ទៀត I tell myself I am a man ជាគំនិតហ្នឹងមិនប៉ុន្តែយើងប្រាប់ខ្លួនឯងថាយើងជាខ្លួនយើងចឹងតិចខ្ញុំមើលឃើញគំនិតហ្នឹងប៉ុន្តែខ្ញុំប្រាប់ថាខ្ញុំប្រាប់ខ្លួនឯងថាខ្ញុំជា
So I'll show you some other diffusion exercises. So you might have fusion, which is, I look like a man. And do you mind doing this? Okay. She's very, very brave. And for all of you, I want to thank you for doing this. Remember, to reveal your vulnerability to a group of friends is really brave, right? And why are you doing it? She's letting herself feel vulnerable so you can learn. That's cool, super cool. Thank you. And things about your appearance are often very difficult. We all feel ugly. We all feel like we're not pretty enough. And to talk about that out loud is very difficult. So thank you. But I'll go back to the beginning. So you said you have this idea that you look like a man. How long have you had this idea?
I think for more than 10 years.
10 years. And so again, same. Do you like this idea?
No,
Do you try to convince yourself it's not true?
I did.
Have you been able to do it?
Sometimes I kind of feel like it's just people's opinion on me, but sometimes I still believe it.
Right.
I'm a bit masculine.
So she's saying exactly what we'd expect. Had this idea about myself. I don't like it. I've had it a long time. I've tried to get rid of it, and I cannot do it. And she's a mental health professional. And so again, from actor, like, exactly. That's exactly how it is. So the best we can do is create diffusion, accept that it's there. We already did acceptance. And diffusion is think about this thought in different ways. So we could sing about it. like we did before. We could push on it like we did before, but here's some other diffusion techniques I want to show you. So some other diffusion techniques are sort of like this. Suppose I have a magic wand, I have magic, and I could tap you on the shoulder, and I could make it so you've never, ever, ever had the thought that you're not pretty enough. I could completely get rid of it and get rid of all your negative feelings, just like that. Bing! No negative feelings. However, if you agree for me to fix you with my magic, I get rid of your negative thoughts about yourself, so you never had them. But the cost would be that you would not be able to understand suffering in others because you would never have had it. So you would have never had suffering. You get rid of it in your life, but it would also make it so that you cannot understand how other people feel when they feel ugly or when they feel not good enough. You would be unable to understand that. So you have a choice. Have your suffering and empathy, or no suffering for yourself and no empathy. Which do you pick?
I would choose the suffering.
Every patient, when you do this, chooses suffering. They choose suffering. That's huge. They're coming into therapy saying, initially, I want to get rid of my depression. I want to get rid of this, and this. And by your second session, they're saying, I want to keep it. I want to keep it. And you're like, wow, that's so cool. So because okay, maybe you could translate that and yeah.
miracle question ណាតែខ្ញុំឃើញថាខុសនេះគាត់កន្លែងមាន suffering មកជំនួសអញ្ចឹង medical question មួយយើងទម្រង់បែបនេះវិញឧទាហរណ៍ថាបើសិនជាយើងមានយុទ្ធសាស្ត្រមួយហ្នឹងយើងគ្រាន់តែថាទៅលើគាត់ប៉ះគាត់រាល់ភាពរងទុក្ខរបស់គាត់ suffering របស់គាត់មានប្រមាណគឺបាត់ទៅអស់គំនិតដែលគាត់ចង់លុបចោលអារម្មណ៍អវិជ្ជមានទាំងប្រមាណដែលគាត់អត់ចង់មានសិលនឹងអាចធ្វើឲ្យអត់ប៉ុន្តែចម្រាប់មួយនេះនឹងមកជាមួយគ្នាជាមួយនឹងការបាត់បង់សមត្ថភាពការយកពីអ្នកដទៃអញ្ចឹងសម្រាប់ក្នុងករណីគាត់ចង់លុបអាគំនិតមួយដែលធ្វើឲ្យគាត់មានអារម្មណ៍ល្អហ្នឹងខ្ញុំប្រាប់ខ្លួនឯងថាខ្ញុំជាមនុស្សផងខ្ញុំមើលទៅដូចមនុស្សធម្មតាអញ្ចឹងរាល់ពេលដែលគំនិតហ្នឹងមកវាអារម្មណ៍អត់ស្រួលចង់ឈប់មានគំនិតហ្នឹងអញ្ចឹងគាត់ចង់ឈប់មានអាហ្នឹងតែបើសិនជាគាត់ឈប់មានអាហ្នឹងគាត់លែងមានសមត្ថភាពយកពីអ្នកផ្សេងទៀតតែមានគាត់ឬក៏មានការរងទុក្ខពីផ្សេងខ្ញុំអត់ស្អាតខ្ញុំខ្លាចខ្លាចអត់ដែលអត់ហ្នឹងគឺយើងមានសមត្ថភាពយកចិត្តអ្នកដទៃអញ្ចឹងឲ្យតែប្រសិនវាយើងធ្វើហ្នឹងគ្រាន់តែមេតាហ្វ័រយើងសួរគាត់ថាបើសិនជាមានសិលការឡើងមែនខ្ញុំដាក់សិលហ្នឹងឲ្យអ្នកមានសមត្ថភាពបាត់គំនិតហ្នឹងទាំងអស់ប៉ុន្តែអ្នកក៏បាត់សមត្ថភាពមួយក្នុងការយកពីអ្នកដទៃអញ្ចឹងជាទូទៅសួរអ្នកជំនួយភាគច្រើន session ទី1គាត់មកគាត់ចង់លុបអាហ្នឹងក្រោយពេលអាហ្នឹង session ទី2គាត់ឆ្លើយទៅវិញថាយើងចង់លុបតែបីទោះបីជាគាត់មករកយើងដំបូងគឺចង់លុបអញ្ចឹងនឹងជាមេតាហ្វ័រមួយទៀតអាចជួយគាត់ diffuse feeling component.
We have another one we do. So another way we can do this a diffusion exercise is I like this one. This is one of my favorite. I'll say, okay, hey, how are you doing?
I'm fine, just the normal typical day.
Typical day, okay. Suppose this weekend you would decide you can see, there's 2 movies that you can go see this weekend, okay? There's 2 movies that she can see. One movie is about a young woman in Cambodia who is successful and lives a good life and has a partner and raises children and grows old and has a happy life. And you kind of follow this person through life, and the movie is about this woman's life. That's movie number 1. There's another movie showing this weekend about a young woman who feels like she's not pretty enough. Sometimes she feels like, I look like a man. And this young woman wants to have love. She wants to have relationships, but she feels sometimes she's not worthy. And she gets up every morning, she gets up with a hope of love in her heart and to pursue connection with others, even though at times she feels wounded and unlovable. And you can see the movie about this young girl going through these struggles and finding love and connection in her life. And we don't even know how the movie ends, but we see her every day facing her struggle and waking up in the moment with hope in her heart and pursuing love even though she feels unlovable. So you can see that movie if you want. Which movie would you rather see? The movie number 1 or movie number 2? Which is a better movie?
I think if I see the first movie, of course it's nice to have that kind of life, but I don't know why would she exist, because if everything is smoothly, it's going well, I feel like nobody will have that perfect life. So I rather choose the second one.
Same. When you do this with clients, they always pick the second movie. A movie with struggle, a movie with challenge, a movie with overcoming obstacles is a much better movie than a boring movie that has no struggle. So what you're doing there with the client is you're saying the thing that you're pushing away, you can have, and it's kind of cool to have it. And it maybe even makes for a better life to have struggle. Struggle is not a bad thing, it's diffusing, it's something that can be viewed with positive or negative, it has different things. So that's third. And then last would be, isn't it true that many of the clients that you see feel unlovable and feel like they're not good enough? True?
My client? Yeah.
And isn't it true that you know a lot about that?
Yes. And especially when they come up with things like they don't like how they look.
There's one person in this room that's super knowledgeable about how to help people who don't feel they're pretty enough, and that's you.
Thank you.
So it's a gift. So again, different way of thinking about something. So that's diffusion, many different strategies. But thank you so much.
Thank you so much.
So those are all diffusion. You can, if you want to translate that.
Chung មិត្តផលទី2ដែលយើងធ្វើមិញឈ្មោះ movie ទី1មិញយើងធ្វើ I already forget ដល់ទី2មិញយើងធ្វើអំពីរឿងមេតាផលទៅលើកូនហ្នឹងចឹងដូចគ្នាដែរនៅក្នុងចំណោមអ្នកជំងឺច្រើនដែរ Professor William បានប្រើមេតាផលនឹងជាមួយកម្រមានអ្នកឆ្លើយទៅលើទី1អញ្ចឹងអានេះវាជាចំណុចពិសេសមួយដែរដែលយើងគ្រប់គ្នាមានអា core belief នឹងខ្លួនឯងយើងខ្លាយទៅជាបុគ្គលម្នាក់ដែលអាច relate ឬក៏យល់ពីអារម្មណ៍ដែលអតិថិជនរបស់យើងដែលមានអានឹងស្តៀងមួយយើងអញ្ចឹងក្នុងករណីនេះ therapist របស់យើងគាត់មាន core belief របស់គាត់ I am masculine អញ្ចឹងខ្ញុំដូចមនុស្សផុសអញ្ចឹងសមត្ថភាពរបស់គាត់ហ្នឹងពេលដែលយើងសួរទៅលើ movie ដែលយើងព្យាយាមសួរមិញហ្នឹងយើងដាក់មេតាផលឲ្យគាត់នៅក្នុងហ្នឹងបើសិនជាឲ្យហោះគុណ2គុណទី1ដូចជាគេប្រចាំងទៅលើមនុស្សស្រីម្នាក់ដែលគាត់មានជីវិតល្អឥតខ្ចោះគាត់មានគ្រួសារគាត់មានដៃគូគាត់មានកូនគាត់មានផ្ទះដ៏ល្អមានការងារដ៏ល្អអញ្ចឹងបើសិនយើងប្រៀបធៀបអាកុនមួយហ្នឹងគាត់មានចម្រើសមើលកុនហ្នឹងគឺសាច់រឿងរបស់មនុស្សស្រីម្នាក់ហ្នឹងក្នុងហ្នឹងគឺបែបហ្នឹងគឺល្អឥតខ្ចោះដល់ពេលសាច់រឿងទី2បើសិនជាយើងជាអ្នករើសវិញសាច់រឿងទី2យើងហោះទៅមើលមនុស្សស្រីម្នាក់ដែរតែគាត់មានបញ្ហារហូតហើយបញ្ហារបស់គាត់ហ្នឹងគឺគាត់មានជំនឿស្នូលមួយដែលគាត់ជឿថាគាត់ដូចមនុស្សប្រុសអញ្ចឹងគាត់អត់ស្អាតហើយរាល់ថ្ងៃគាត់ទៅធ្វើការងារប្រចាំថ្ងៃគាត់ដោយប្រឈមជាមួយនឹងអាគំនិតនឹងប្រចាំថ្ងៃអញ្ចឹងរឿងរ៉ាវរបស់គាត់កុនមួយខ្សែទៀតដែលយើងអាចមើលហ្នឹងគឺមានលក្ខណៈច្រើនក្នុងការប្រឈមនឹងបញ្ហាអញ្ចឹងក្នុងលក្ខខណ្ឌនេះដែរបើសិនជាយើងអ្នករើសមេតាផលរបស់យើងសួរមិញហ្នឹងរវាងកុនពីរហ្នឹងកុនមួយដែលមានសាច់រឿងពីមនុស្សស្រីម្នាក់ដែលល្អខ្ចោះមានដៃគូបែបនេះជាមួយនឹងកុនមួយទៀតដែលអត់បង្ហាញពីភាពអត់ខ្ចោះទេប៉ុន្តែបង្ហាញពីបញ្ហាច្រើនដែលដូចកុននឹងជួបឧបសគ្គនេះផងស្អែកឡើងជួបឧបសគ្គនោះទៀតគ្រាន់តែរបស់យើងក្នុងនេះយើង highlight ជាមួយនឹង core belief របស់គាត់អ ចឹងយើងសួរគាត់ទៅមិញថាពីរហ្នឹងគាត់ត្រូវយកមួយណាចឹងកុំរណាស់ដែលយើងទៅរើសមើលដែលអតិថិជនយើងនឹងរើសមើលកុនទី1ដែលមានភាពល្អឥតខ្ចោះចឹងគាត់បានជ្រើសរើសយកកុនទី2ចឹងកុនទី2នេះឯងជាចំណុចដែល unique ដែលពិសេសសម្រាប់ therapy មួយចឹងយើងអាចคลายទៅជាអីមួយជាចំណុចខ្លាំងមួយទៀតបើសិនជាយើងមានអា core belief ឬក៏ជំនឿស្នូលរបស់យើងហ្នឹងស្តៀងទៅនឹងអតិថិជនចឹងគេថាបើសម្រាប់ខ្ញុំវិញខ្ញុំ relate ខ្លាំងជាងសម្រាប់អ្នកដែលគាត់មកវិញខ្ញុំមានគំនិតថាខ្ញុំអត់ទាន់ល្អគ្រប់គ្រាន់ទេអញ្ចឹងគ្រាន់តែ client មកយើងដឹងថាអារម្មណ៍ហ្នឹងមិនតែអីដែលយើងខុសប្លែកយើងចាប់ដើមមើលឃើញយើង diffuse វិញហើយខ្ញុំដឹងខ្ញុំប្រាប់ខ្លួនឯងថាខ្ញុំមិនល្អគ្រប់គ្រាន់ client របស់ខ្ញុំគាត់មក I'm not good enough គាត់ខ្ញុំមិនល្អគ្រប់គ្រាន់ទេតែដោយសារតែខ្ញុំឆ្លងអាហ្នឹងដែរនៅពេលដែលខ្ញុំ diffuse ចឹងនៅពេលដែលខ្ញុំ diffuse ខ្ញុំប្រាប់ខ្លួនឯងថាខ្ញុំមិនល្អគ្រប់គ្រាន់ចឹងខ្ញុំខ្លាចទៅជា therapist ម្នាក់ដែលមានសមត្ថភាពយល់អា fusion នឹងខ្លាំង
Okay, so now we'll do an exercise that will help you learn about how strong it is to avoid and how you can practice diffusion with each other. So we're going to pair you up. Let's see, how about you and you, and you and you, and you and you, you and you. Let's see, you and you, you too, yep, you and you. You and you, and let's see, how about you can go with her, I think, yeah. Then you and you, you and you, you and you. Oh, it works out perfectly. So what I want you to do is, wait, did I miss somebody? Oh, I'm so sorry. Would you mind? Okay, we have. So what I want you to do is turn your chair so that you're facing directly this person. Okay, we'll get, okay. So your knees are almost touching, like face to face. Okay. Good, good. Nice to turn towards her, just so you're turned right towards each other. Yep. Very nice.
I think some of them went to the point.
Pardon? Oh, okay, okay. So we'll wait for them to, okay, we'll wait. There are a couple people are in the bathroom, so we'll be there in a minute, but just get comfortable. You're going to have an interesting experience.